All right, welcome back to the Lightning Step Couch. My name is Benjamin Turner. I am your behavioral health advocate. We are coming to you again from Denver, Colorado at the NAATP 2024 conference. Sitting next to me is Dr. Amber Lange from Capella University. She is the Director of External Partnerships for Site-Based Learning. Dr. Lange, thank you so much for joining me today.
Thank you.
Can you tell me a little bit about yourself and what you do with Capella University?
Sure. So, my role at Capella University is to help interns that are in the mental and the behavioral health space, in the nursing space, the public health space, and the education space. So, on any given year, that could be 10,000 students across the United States. Capella is an online university, and we have degrees in mental and behavioral health, nursing, IT. And so I work to partner with organizations that need interns and then to help to make those connections between the organizations and the interns.
Okay. Can you tell me a little bit about the importance of these interns and facilities?
Oh man, it is so important, especially in today's market. The need for healthcare employees is profound. And so the fact is, I have a talent source with knowledge and current knowledge, which is really kind of a prime thing because lots of times we have people who are in the workforce and they've been there for quite some time and continuing education. The thing that I think an intern can bring is vibrance for sure, enthusiasm, and real current knowledge. And so they're a great place to look if you need help. And I think even more than that, one of the things that's really good about them is that they are able to begin with you and they still need some molding. And you can train them in your modalities, your policies and procedures. So by the time they're done with an internship, their ability to step into an employee role is seamless.
Yeah. What are the difficulties getting these interns into facilities? Why are you stressing this
Sure.
and what are you dealing with?
Well, probably one of the biggest things is if we go back to just the fact that there's such a crunch in terms of employment in the mental and behavioral health space. So I need enough supervisors to be able to supervise these. And everyone in mental and behavioral health is taxed right now, is taxed beyond tax. So they don't really have the time, the energy. You can't take an intern and then do nothing with the intern. They still need that molding, especially in therapy and clinical skills, and even in roles in administration and in healthcare. So it still kind of falls back to the fact that we need more people, we need good people, we need supervisors that are willing to invest. But even more than that, because Capella is across the United States, we're always looking for partners. And so, who can we partner with? And it's almost an opportunity that sells itself. Companies need interns or want interns, and we have them.
Yeah.
So,
What are some misconceptions about interns that you would love to dispel?
well, I think that interns can get a bad rap because there's a cohort of bad interns who show up in unprofessional clothing, who don't take their internships seriously like they would take employment, that um, aren't open to feedback. And so, and while sure, but that exists with employees. Let's face it, that's not like interns aren't in this unique space where they're special because
Yeah.
they are inappropriate in some way.
Yeah.
So, but I do think that sometimes one bad intern can really spoil the bunch, and
Yeah.
where a company then turns around and says, "No way are we taking any more interns." And so, but I would like to say that I mean, 10 10,000 interns, and they graduate, and we love them, and we want them to foster and go on to have a career to supervise the next generation, even at our own university.
Yeah.
But I think that one don't let one bad intern spoil the bunch.
So obviously we can't prevent, we can't have a 100% success rate. There's going to be a bad apple here and there. But what is Capella University doing to produce better interns?
Sure. So I would say one of the really cool things that we do, and this isn't across every single program, but for many of our clinical programs, people can't just be in an online degree and hide behind their computer. And so they have to come on site. They have to be able for like 3 to 5 days. They have to sit like we're doing, except they're doing counseling and they're doing assessment, and they have to prove and show that they have the skills necessary to be set free. And so I think that that's an important thing, especially when we look at, especially since COVID, and how so many programs have gone to an online format. But we're making sure that they're trained enough. And they have to do it sometimes twice within their program. And so by the time we're setting them free, they've carried entire counseling sessions on their own. They've had to do assessment and diagnosis. And so ideally, they're hitting the ground running, even within the internship.
Okay. I want to talk a little bit about technology. So every facility is using a multiple levels of technology in different ways. What is Capella doing to prepare the interns to walk into a facility and understand the technology that's being used and to be able to move in as seamlessly as they can?
It's a great question, and I'm glad you asked because within the higher education environment, there's so much debate about the use of AI as part of students responding. Like, what are we going to do? All students have to do is kind of ask AI the questions that we present them and give the answer. And so there's tons of debate going on within higher ed right now about should we embrace it? Should we not allow it? Lots of institutions have set up policies where it's like it was considered plagiarism for students to use AI, but not us. And so, one thing that I really respect about our company is that we are embracing it full force. We want students to be able to use it in a way that's responsible to inform their knowledge. We want our faculty to be able, and so I don't think that we will be anything but a trailblazer, just like we were a trailblazer in terms of online education, because we were doing these kinds of programs over 30 years ago when everyone said you can't do these kinds of programs online.
That's awesome.
One way that we've embraced technology recently is through our integration with Microsoft Office.
Hmm.
And literally, all faculty are in the midst of being trained to use the AI that's accompanies the Microsoft suite. And so we're doing everything we can to upskill our own faculty, kind of like we have our own set of interns that are upskilling to be able to be prepared, to be able to utilize this in responsible ways and in ways that foster better higher education for the faculty and the students.
Yeah. I think Lightning Step really shares your vision when it comes to AI and some of the advantages and where that's going to be going. I want to talk a little bit about specific EHRs, or not specific EHRs, but EHRs. What do you train your staff on? Do you train on a multitude of EHRs? Is there a specific one that you picked and stick with? Can you talk to me a little bit about that?
Sure. So we don't I would say that our experience in the EHR domain is more in teaching students about it.
Hmm.
Because as a higher education institution, we're not really working within um, a traditional EHR system. So, but we are teaching students what it means and examples and how its value brings like value to their time management as therapists and clinicians and nurses, because EHR is obviously something that's here to stay. And so we were embracing that kind of education for the students. I want to say maybe even as much as 10 years ago when EHRs were just coming in. No, like everyone, especially within the clinical environment, really relied on notes
Hmm.
and the value of handwriting. And I think that as we continue to educate, that idea will become so antiquated. It's antiquated now,
Yeah.
but
Hmm.
I don't know. It's something that therapists hold on to.
Absolutely. No, we're
So,
still converting a lot of major facilities from paper to electronic. So we understand that there is a lingering, a desire to just hold on to that process.
there is.
But there are some amazing advantages to switching to electronic health. Are you teaching
Absolutely.
are your students doing paper notes? Is that how you guys are training? I know you're an online facility, but how are they documenting and doing that today?
Sure. So they would be doing that as part of their internship. And so really we wouldn't be privy because they're real clients with
Mhm.
real notes. They have the supervisors that they would have on site. And so across the thousands and thousands of places where students are, it's kind of on a case by case basis to the degree beyond their like academic education, the actual utilization would be happening at the company or organization.
Mhm. Okay. I really appreciate your time today. I don't think we talk enough about interns, the bad rap they may get, but the importance of having them. They are the future of care.
Yeah.
We are in a desperate need for more behavioral health professionals. I think there's a study out there that by 2030 we'll need 10 million more to help uh, uh, take care of those that are afflicted. So we need to make sure that we're taking care of the next generation that's coming in. And I think Capella University is doing a great job. So, Dr. Lang, I
Thank you.
appreciate you sitting down. Is
Thank
there
you.
anything I didn't cover? Is there anything? We've got listeners and facilities. We've got leadership that's watching this. Is there any last message you want to stress to those listening?
Let me think for a second. You caught me off guard with that question. What would be my parting words? Give it a try.
That's yeah. Give them a chance.
Give them a chance.
Believe in the process.
Yes.
All right.
Yes.
Dr. Amber Lang with Capella University. She's got a great long title here, Director of External Partnerships for Site-Based Learning. Thank you again for your time.
You're welcome.